Hi, everyone, and welcome to a fresh episode of Ask the Pediatrician Hour. It's my pleasure to welcome you from whichever platform you're watching me from today. Thank you so much for joining. For those watching on Ask the Pediatrician's Facebook page or Fresh Ways Facebook page, and those who are also watching or listening on the podcast, and those watching on YouTube, I want to bid all of you a fresh welcome to a fresh episode of Ask the Pediatricians Hour. Thank you so much for joining us today. My name is Bemi Salaboide. I'm a pediatrician, and I'm going to be your anchor for today's broadcast. And today we're going to just continue on what we've been discussing for the past 2 weeks, looking at the myths and facts that are related to child health issues. Before I continue, I just want to let you know that this program is brought to you by Hacks the Pediatricians Foundation. We are very committed to the health and welfare of children globally, and we do that through health education information online, and we also do community medical outreaches to communities with very limited access to pediatricians and healthcare professionals. uh, if you have any questions about the health of your children or even your own health issues, feel free to post it on our Facebook group, Ask the Pediatricians Facebook group. You can't miss it, and you are there from Mondays to Saturday, and we will be able to answer your questions by our professionals. So feel free to ask any health related questions about your children on our Ask the Pediatricians Facebook group. If it is something that is adult health related, you can post it on ATP Family. And for those who have experienced either pregnancy or child losses, feel free to join our ATP Still a Mom group for psychological support. And you can also ask your questions on that group as well. And if you want to have private one-to-one chats with our pediatricians or any of our professionals, or you even want to have a consultation with them, feel free to send out a WhatsApp message on +2349056916818, or you can just email clinicsatp@gmail.com, and we'll be able to provide you some support. So thank you so much for joining us. And I also want to remind you that our community medical outreaches for May and June are coming up, and that will be in all the states, including the FCT Abuja. We are doing at least 40 community medical outreaches in each of the 36 states of Nigeria and the Federal Capital Territory, Abuja. So we will appreciate your support. You can support us by volunteering, or you can donate financially and sponsor one child for any amount that is convenient for you. Our account details are showing on the screen for those who are watching, and for those who are listening, you can just go to our website. You see our account details. You can also donate on our website. Actually, for those who are outside the country, you can give via our global giving page. And if you're a corporate organization, or work for a particular corporate organization that are interested in children health issues and would like to collaborate with us, we welcome all such collaboration. Feel free to send us a message on our WhatsApp platform, and we will get back to you. So we look forward to your support. And I think the very first outreach is going to happen on the 14th of May. And so many outreaches will be happening throughout the whole of May and June 2022. We call it our Children's Day Community Medical Outreaches. And we really look forward to supporting lots of communities that have very limited access to healthcare professionals in Nigeria. So you're welcome to support us, and thank you so much as you do so. All right, so I think that's all my announcement, and I'm just going to go to the topic of today. And we've been talking about meats and fats as related to children's health. We've talked about part one. We've talked about meats, about newborn issues. Then we went to talk about last week meats that are related to nutrition. Then we talk about meats related to teething, and we also talk about meats that are related to um, immunization. I think that's what we talked about last week. And so basically, myths are beliefs that are very popular, that are very held by many people, but they are actually not true. And we know as part of our job as pediatricians that some of the myths that are held as regards to health issues of children, they can actually impact significantly on the health of children. It can affect even whether children can live or die, because if people have the wrong beliefs about what is the cause of an illness or how it should be treated or how it should be managed, it may end up not being done properly, and we may end up losing a child. And as an organization that is committed to zero deaths of children from preventable causes, it's so important that we address such important topics. And I think I'm just going to round it all up today. I hope I won't have to go to the fourth part, but I'll try and cover as many as I can do today. So I'll be a little bit faster and limits my explanation. So most of the myths we're going to be talking about today are myths that relates to health issues, like diseases or the treatment of diseases. And then we'll talk about a few miscellaneous ones that I cannot put under any particular category as well. They are so important for us. So let's go to so we've been talking about so many myths, and now we're in number 44. Wow. And I'm sure I've not exhausted all the list. I think I'm just going to limit myself to 70 of them, but I'm sure many of you also know a lot more. And I've seen a lot of people on that comment sharing with us some of the other myths that relates to children's health issue. Okay, so the first one I'm going to talk about today is that relates to antibiotics. People just believe that anything wrong with a child, any illness, any health issues, just go and give them antibiotics. So a child is coughing, a child has fever, people just go ahead and give antibiotics, and this is actually wrong. Indeed, most of the time children do not need antibiotics when they have, because most of the common illnesses the children have, like their cough and their colds, diarrhea and all that, they are most of the time due to viral infections, and viruses don't respond to antibiotics. So using antibiotics for such illness, number one, is unnecessary. Number two, it is dangerous, because what happens is when you use antibiotics when it is not necessary to be used, then you are predisposing that child to developing what we call antibiotic resistance. So in other words, when the child eventually now needs to use the antibiotics, it is not going to work for the child, because the child has now, or the germ has developed resistance to the antibiotics. And this can be a dangerous situation, because sometimes we don't have unlimited number of antibiotics. In other words, we have very limited number of antibiotics. So if children begin to develop resistance to them, we'll get to a point where there's no other medication available. And actually, the World Health Organization and many of the infectious diseases experts were beginning to get alarmed, because we are not releasing more new antibiotics. So we see it's the old ones we have. It's still the common ones that we have that we're still going to have for a long time. And that is why we should only use them very judiciously and very carefully. In many developed countries, as parents, you cannot just buy antibiotics without a prescription by a medical doctor. But in countries like Nigeria, there's not much of regulation. And so anybody will just go to the pharmacy or the chemist shop and just pick up antibiotics. And when I see mothers on our Facebook group telling me they've gone to buy like Augmentin, they've gone to buy Zena, these are very powerful antibiotics that even most pediatricians will not be the first thing we're going to prescribe for your child. And yet I see parents using this like pure water. It is a very dangerous thing to do. So please do not give children antibiotics if they have not been prescribed. I see a lot of mothers, their children, when they, in fact, some mothers believe that they are going to parties, even because they think that because they are going to eat a lot and they are going to have diarrhea or purge, as they call it, then they should just start using flagyl, which is very dangerous. This is flagyl is an antibiotic, so it's not something you just use anyhow like that. So we should stop that attitude and that belief of just using antibiotics for any and every illness. In fact, you should not use antibiotics unless it is being prescribed by a health professional, usually your doctors. Okay, the next question, the next myth, sorry, I'm used to always answering questions, but today I'm actually doing a podcast, so it is not question and answer session. So the next myth is that of chickenpox is God sent. So this is a belief that some diseases are actually good for children to have them, and some people actually believe that it's good for children to have chickenpox. But actually, that is not true. Chickenpox is actually a viral infection, and it is actually one of our vaccine preventable diseases. So there's chickenpox vaccine, even though for us in Nigeria, it is not yet part of the NPI vaccine. NPI stands for Nigerian Program on Immunization, or the National Program on Immunization. So which means these are the vaccines that the governments are going to give you for free. So chickenpox vaccine or varicella vaccine is not yet part of that list. Hopefully it will become part of it soon, but it is not. So which means you have to pay to get a chickenpox vaccine, but it's available and you can actually give it to your child. And chickenpox, even though most of the time it resolves without causing much issues, but it's actually a viral condition, illness that can actually cause serious complications. It can actually get to the brain and cause meningitis and so many other things. So it is not something you want to have if you can avoid it as much as possible. So there's no disease that is God sent. There's no disease that is good to have, and chickenpox is definitely not one of them. All right, another condition, people believe that there are certain diseases that children cannot have. So when people think that children cannot have things like diabetes or hypertension or mental health, so it's very difficult for some parents to actually understand that children can actually have those conditions. And when children are having symptoms of those kind of illness, people just don't take it serious. Unfortunately, it can be very dangerous. For example, if a child has diabetes, and most children, when they have diabetes, they have what we call the type 1 diabetes mellitus, which means they need insulin. And if they're not the type that take drugs or diets like adults, they need to have insulin. So if you don't take them to the hospital or get it diagnosed or treated, such children can have the complications of diabetes, like what we call diabetes ketoacidosis, DKA, and they can go into coma and they can die. So there are some diseases that people think, oh, this is only for adults. Actually, it is not always true. And most of the diseases that we believe they are for adults, children can actually have their own version. So children can have hypertension, children can have diabetes, children can have mental health issues. So this is not to scare us, but it's just to let us know that it's possible and for us to go and take such children to the hospital. And some other myths is the fact that things like diabetes is caused by sugar. I don't know whether it's in the list of my myths down the line, but I think I should just ship it in, that the fact that you take sugar is not what is causing the diabetes. Most time diabetes is due to, for example, for children, it is due to a problem with the organ, what we call the pancreas, that is producing insulin. And so the insulin that controls the sugar is not well, it's not produced in enough quantity. And so that is why the children cannot handle their sugar and move it to the right place. And that is why we have to give them that insulin as injection to move the sugar, into the right places. That is a very, very simplified version of what is going on. But I think it's something that a parent can understand. Obviously, if a child is not having enough insulin, the less sugar in their system, the less work for the remaining whatever quantity of insulin that the child is producing to handle. So it makes sense that they don't have to eat a lot of so much sugar and the diet has to be controlled. But that is not to say it is the sugar that is causing the diabetes. It is the lack of insulin or reduced amount of insulin that actually leads to the diabetes. But when you have reduced amount of insulin, then you don't want to overwhelm the amount available. So you want to make sure you give food in reduced quantity or in quantity that the body will be able to handle. And of course, you also give external dose of insulin to help handle those drugs. But I think the focus here is just for that children can have diseases. So and if your child has those diseases and you've been to the hospital and they've been diagnosed, please follow the doctor's treatment. Let's not go into, God forbid, it's not my portion in Jesus' name. That's the usual response we get when parents get this kind of diagnosis. So, yes, but we want you to at least do your part, and while you pray, you also let the doctors do their part. So it's okay to take your medication, and it's okay to do what the doctor asked you to do, even though you are praying. I hope that is helpful. All right. The next myth is that some people believe that when children have nasal discharge that is green, it always means the child has bacterial infection. Well, this may be partly true, but it is not always true. Okay, so sometimes it's most likely it's a bacterial infection, but it may also not always be. And sometimes when children have put things in their nose, some of them like to put things in their nose. It's experimentation for them, and sometimes they can have green nasal discharge as a result of the obstruction. And so even some other infection can also cause it. So it is not always every green catarrh, as people call nasal discharge, that says bacteria, which by extension means it's not you have to give antibiotics only to see yellow, thick, or greenish mucus coming out from the nose. You don't necessarily have to. Most nasal discharge or catarrh are still due to viral infections, and they don't require any antibiotics. The next one is if a child is bleeding from the nose, nosebleed or epistaxis, it means there's a serious problem with the child. Actually, that is not true. In fact, nosebleed is very common. It's very common in some age group, and in those age group in children, sometimes there's really no cause. In fact, sometimes there's no cause. It's just something that some children just have, and it's not because they are sick. It's not some children because they pick their nose. It also can make them bleed, or when they have catarrh or any infection, and then they begin to pick on the nose and all that, it can also make them to bleed and have nasal bleeds. But it is not because they have like maybe a cancer in the brain or something very serious like that. No, it is not. So most of the time it's either nose picking or due to no cause at all. It's not something to worry about. The most important thing is to know the first aid to do. And what you need to do is to pinch the nose, and just pinch the nose with the child leaning forward. Most people tend to go the other way around. It's actually the wrong approach. You just pinch the nose with the child leaning forward, and it will stop. But if it is coming on frequently, then you may want to see the ear, nose, and throat doctors. But most of the time, it's a minor thing, and most time children outgrow it and they will stop having the nosebleeds. The next question, this one is a very popular one, that when children have red eyes or infection, you should put breast milk in the eyes. That breast milk is a treatment. And I see mothers say that all the time. I see it on our Facebook group. I see it, in fact, sometimes when people are asking us questions before you answer, somebody is jumping ahead of you and saying, go and put breast milk in the eyes. This is a very popular myth, but it is completely wrong. I always tell mothers breast milk is food, it is not antibiotic. So please do not put breast milk in the eyes. And the ophthalmologists, the eye doctors have warned against it. And they've actually found that some children, it can worsen things and it can cause problem with the eyes. And with eyes is a very delicate organ in the body, so you don't want the child to become blind because you are trying to treat something and creating another problem. So I just want to use this opportunity to reassure you that eye infection cannot be treated with breast milk. Okay, if your child any discharge in the eyes, feel free to take the child to the hospital and let the doctors do the right thing. Let them examine the child. If the child needs an eye drop, let them prescribe. But please do not, okay? Let's not be putting breast milk in the eyes. Breast milk should go in the mouth. Breast milk is food. It is not eye drop. It is not an antibiotic or antiviral anything. I know that breast milk is very wonderful. It has a lot of good properties. It has antibodies and all that, but it is not for treating the eyes. It is meant to be swallowed and digested and absorbed into the blood to work. So please do not put breast milk into the eyes as a form of eye treatment. All right. The next one is what causes jaundice. People believe that when you wear yellow clothes is the cause of jaundice. Actually, this is not true. Okay, wearing yellow clothes is not the cause of jaundice. I'm not sure whether I've done a podcast on jaundice, but definitely I've written about jaundice on our website. You can read about neonatal jaundice, or we have had good discussion about jaundice. But jaundice is one of the most common condition in newborn babies. 60% of all newborn babies will have jaundice. 80% of all preterm babies that are born before 37 completed weeks of pregnancy, are going to have jaundice. So jaundice is really, really quite common. And so it's so important for us to know about jaundice. But jaundice is not caused by wearing yellow clothes. This is a very popular myth, and I see a lot of grandmothers and a lot of sometimes some of our nurses, telling new moms don't buy yellow clothes, don't buy yellow this, and some people believe that it is those wearing yellow clothes or whatever that is causing the jaundice. It is not. So jaundice is due to the fact that it is the breakdown of the red blood cells. Okay, and either the red blood cells are broken too fast and the liver of the newborn baby cannot quickly clear it out, or the liver itself is not well matured. There are many other things. So, but the issue here is that it has to do with red blood cells being broken down and it's being cleared out from the body. So it is that is the process that is going on, and there are conditions that make the red blood cell to break down so much more than the body can handle, or the liver cannot clear it out, or a mixture of the two. But it has nothing to do with wearing yellow clothes. Of course, there is some wisdom in the sense that when people are checking for jaundice, if you are wearing yellow clothes, it can reflect into the eyes. And some people are not sure whether it is the reflection of the clothes the baby is wearing or it is the baby actually have jaundice. But usually there's a way to go around that. Usually when we want to examine a baby for jaundice, we use natural lights, we use white light. So we look, and of course we take out the clothes and we look to know. So that is maybe that's the little wisdom that may be in that place. But otherwise, the clothes itself, it's not the cause of the jaundice. So it's okay for you to wear your baby yellow clothes if you want. It is not going to cause jaundice. All right. The next question is the next myth. 51. I should avoid milk products when my child has cold. Again, some people believe that when children are sick, this is just an example, but when children have certain illness, you avoid certain food and all that. It's actually that it's not true. If your child, some people believe that maybe when they take milk, it makes the nose much more blocked or whatever. So if you have milk allergy, you avoid milk. But if you don't have any milk allergy, it is not, you can give your children milk. It does not cause any extra problem for them. So milk is a very good drink for children generally, at least below the age of 5. So we always want to give them either water or milk. So there's nothing wrong with giving your children milk. It does not make the nose or the cold to be worse. It does not cause the nose to be blocked. It does not cause any of that, unless for people that really have milk allergy, which some people can have. All right. Another common myth, again, let's just stay with the code a bit, is the fact that people believe that if your child goes out in the cold and they don't wear clothes, I mean, that is what is going to make them to have catarrh or have cold or respiratory infections and all that. Of course, there's some wisdom in the fact that you need to wear appropriate clothing in appropriate weather. But most respiratory infections, are due to germs. They are due to either viruses or bacteria. They are not due to the weather itself. Okay, obviously, when you are cold and you're not wearing clothes, you're putting a lot more pressure on your immune or your body system to generate heat and to keep you warm and all that. And being cold, what we call hypothermia, has its own complications as well. So that is not, we are not saying that you should just not wear clothes for children or you should expose them to cold. But we are trying to say that it is not that exposure to cold environment that is causing the catarrh or the respiratory tract infections. No, the hypothermia can cause its own complications and its own difficulties, but most infections, or what we call acute respiratory infections, they are caused by germs, so they are not caused by the exposure to cold. It's very, very important, because the issue is that if you think they are caused by exposure to cold, then you will think that when you wear clothes for them, that's why some mothers will complain, oh, even when I wear clothes for my child and the child is sweating and is hot, is still having the nasal discharge, is still having the cough, is still having the catarrh. So because the mother felt that, okay, if it is the cold that is making my baby to have cough and catarrh, then when I've worn clothes and I've kept the child warm, so why is my child still having the cough and the catarrh? So that is why, this is what this myth is trying to address, that the cough and the catarrh is due to some viruses, whether it's another sibling who has come back from school and has sneezed or coughed onto the baby, and the germs has been passed on to the baby. So that is what is making that baby to have the respiratory infections. It is not because the child has gone out without wearing clothes or the child has been exposed to cold. I hope that is clear. But we're not saying you should associate your child to cold, but we're just trying about the cause and of respiratory infection. It's actually a wrong term, what we call a misnomer, to call acute respiratory infections like nasal discharge, to call them colds, because that is why people now think it's exposure to cold that is causing colds, but really it is not. The proper name for it is respiratory tract infections, and they are not caused by colds. They are caused by germs, viruses, bacteria. Those are the causes of such infections. All right, another one is, so this is a follow on to to number 52. Number 53, I remember growing up, and people, when as a child, maybe you've gone to visit family holidays and stuff, and you want to lie down on the bare floor, as there will be too many people in the house, and sometimes some of those floors, they are not covered with carpets and all that. People were like, no, no, don't do that. You're going to catch pneumonia. I can still remember one of my mom's friends saying that you're going to catch pneumonia because you're lying on the bare floor. Actually, that is not true. So the fact that a child lies on the bare floor does not cause the child to have pneumonia. Pneumonia is a very serious respiratory infection. So when I was talking about cough and catarrh, we call those one the upper respiratory tract infections. Pneumonia is a lower respiratory tract infection. It affects the lungs mostly. So it is not caused by the child lying on the floor. Okay, pneumonia is not caused by lying on the floor. It is not caused by not wearing sweater or by going out in the cold and all that, or by rain falling on you and all that. No, those are not the causes of pneumonia. Pneumonia is caused by bacteria most of the time. Viruses can also cause it getting into the lungs, and that means that if the body immune system or protective pathway to keep them away from getting to the lungs has been breached for whatever reason, and that germs has been able to travel down, usually from the airway. Sometimes they come through the blood as well, and they get into the lungs. So a child does not get pneumonia because they were lying down on the floor, or cold floor, or bare floor, whatever. It is not true. It is just a myth. And it is so important, because if you don't know the cause of an illness, you are not going to address it. You are going to be chasing the wrong thing or chasing shadows. Okay, another common myth is that high fever will cause harm to children. You should always bring down fever immediately and all that. I understand that we always try to encourage parents that when fever is high, you can make children to have convulsion. But you must understand that fever is not our problem per se. Actually, fever is actually a symptom or a sign, depending on who is looking at it, that is telling us something else is going on. So our focus is not actually just be reducing the fever, reducing the fever. No, our goal is to know what is causing the fever and addressing the underlying cause of the fever. And this is so important, because sometimes mothers say, my child has fever, I've been giving paracetamol for 1 week, 2 weeks. That is not how to go about it, because the problem here is not the fever. The problem is, why is the child having the fever? And every fever is not caused by malaria, like most Nigerians would believe. In fact, they call it malaria fever. Fever is just high body temperature. It tells you something is going on, and you need to address what is going on. It could be something as mild as immunization or dehydration, but it could be something due to a serious infection, serious illness that needs to be addressed. So that is the most important thing. The fever itself is not the problem. We don't want fever to go too high, because it can cause convulsion when it is high, especially for children between 6 months and 6 years. The most important thing is to get the underlying cause of the fever itself sorted. All right, the next one is putting children's hands and leg in fire when they're having convulsion to stop convulsion. Again, this is a very dangerous thing. I think I need to come and do a podcast on convulsion itself, and we talk about causes of convulsion, why children have convulsion, and what to do when children have convulsion. But let's just address this myth that when children have convulsion, putting things in their mouth and all those things people do, that they must not clench their teeth together. It's absolutely not true. It doesn't have any medical basis. So it's okay if they want to clench their teeth, let them clench their teeth. It's not that clenching their teeth that's going to kill the child, okay? What kills children who are having convulsion is the lack of oxygen getting to the brain if the convulsion continues, because when they are seizing, they are using all the oxygen, and the brain also need oxygen. So that is why we don't want convulsion to go on for too long. And there's no first aid to stop convulsion at home. For parents, there's none. In fact, for some of our children that tend to have epilepsy, we have to give parents the medication to use at home. Something they can put either through the anus, because when a child is having convulsion, the worst thing you can do at that time is to put anything through their mouth. You should not put anything through their mouth, because it can go the wrong way. So you should not force anything through their mouth. You should not put anything in their eyes. You should not put their hands in fire. You should not put their legs in fire. I remember a child that we managed. This child had fever, had convulsion, and then some people, I don't want to call them names now, they went to put the hands of this child in fire, put the legs in fire. By the time the child was admitted to a hospital, I mean, the cause of the convulsion is not even a major one. Maybe it's malaria. I can't even remember. But what we were dealing with and what kept that child in hospital for several weeks was the burns that was caused by people intentionally, because they think they were trying to treat the convulsion. Now they've created more problem that caused that mother several thousands of naira. And then the child still had complication. This child still need to have surgery. You people don't understand that burning of the hands and the legs, they are very serious, because they are functional part of the body. So the child needs to have operation. We're not even sure whether the child can use their hand. So please, if you don't know what to do, like we always say in medicine, first do no harm, do nothing. It's better to do nothing than to do something and cause more problem and cause more harm to the child. So the first principle in medicine is do no harm. It's one of our ethical principles. If you don't know what to do, don't add to the problem. Okay, and I know many of our proverbs we have those kind of proverbs that address the issue. So if you cannot solve a problem, at least don't add to it. If your child is convulsing, you don't know what to do, leave the child alone. When the convulsion stop, bring the child to the hospital, but don't cause more problem. Most of the time, people put this omorogun like pestle or spoon in the mouth, they break the whole teeth, and then the child will now need to go and see the dentist again when the convulsion has gone. So please, let's stop all this saying. If your child is having convulsion, the most important thing to do is to keep the child safe. Don't let the child injure him or herself. So remove any tight clothes, keep anything that they can fall into. Just make sure they are safe, and usually wait for 1 minute. Most of the convulsion will stop, and then take them to the hospital. If it doesn't stop, call the ambulance if you have the ambulance service. If you don't have, just go to the nearest hospital. Most hospitals will have the injection they can give to stop the convulsion. You don't have those first aid at home. It's usually at the hospital, or in some cases we give some parents some things to use at home, but not everybody will have that, especially for a child who has not been convulsing before. But please don't do any of these things we usually do. It's dangerous, it creates more problem. Okay, I think I've answered this one about putting breast milk in the eyes. Okay, yeah, but this is the eyes that some children have what we call crossed eyes or squints. When they are looking straight, it's as if one eye is looking the other way. We call that squint. Some people also believe that using breast milk will correct squint. It doesn't. So please do not use breast milk in the eyes. We've talked about the danger of that. Another major common thing that people do when children have taken poison. I think about 2 weeks or 3 weeks ago, I talked about poisoning in children, and I actually talked about kerosene poisoning, and I emphasize this myth a lot. A lot of Nigerians believe that palm oil is the universal antidote. Okay, they believe that palm oil is the universal antidote. They call it error in Yoruba language, which means that if you need something to calm down the situation, you go and get palm oil. It is not true. And it is actually a very dangerous thing to do. I've written a story before of a child who drank kerosene and then they end up giving palm oil. And of course, the child vomited. The child ended up in the ICU. I think we lost that child. So because we don't want you to give a child who has taken kerosene palm oil or even any poison at all, don't give them palm oil. Palm oil is like an hydrocarbon. So children, when they vomit, because that's what people are trying to do, you want them to vomit and you give them palm oil. When they are vomiting the palm oil, it can turn into like gas kind of and go into the lungs. And when it gets into the lungs, it causes a very serious kind of pneumonia. We call it lipoid pneumonia. I've written an article as well about palm oil antidotes. It's a dangerous thing to do, but it's a popular thing in Nigeria. And so please stop it. And if you want to read more about that, I'm sure if you just Google palm oil antidote, the danger, you will see, because I think many news media carried that particular article then because of this particular story that I was telling you. So please do not give children palm oil. Don't put it in their mouth. If they've taken any poison, within the first 1 hour, get down to the hospital. Don't do anything again. If you cannot save the child, don't cause no harm. Giving them palm oil to drink on top of kerosene poisoning is going to make it worse. It may even kill the child rather than the kerosene poisoning itself. So let's not do that. It's a very dangerous thing to do. Then another myth, this one is a funny one, that when breast milk touches the male child genitals, like the penis, is going to turn the child, it's going to make the child impotent. Actually, that is absolutely not true. Okay, your breast milk touching the potency and all that of a child has nothing to do with the breast milk touching the penis on the outside. No, no, no. There are a lot of hormones, there are factors in the inside, not on the outside, that determines virality, fertility, and stuff like that. So for mothers, if your breast milk drop on your baby's genitals, please don't be scared. It is not true. It does not make them impotent. Another myth is that when you maybe take milk or cow milk, it worsen reflux. Actually, this is not true. A child either have reflux or does not have reflux, but it is not milk that make it worse. Okay, and we've talked about reflux. Just keep the children upright, and if the reflux is so bad, then you need to see a pediatrician because we have medications we can give for reflux. What we generally tell mothers is avoid any food that tends to make your child fussy. Anything when you give your child they are fussy, you want to avoid that. But you can give your child milk, it doesn't worsen reflux. Another myth is that milk is a must for all children. Yeah, it's good for children to take milk. Milk is good. It has so many nutrients. In fact, there's actually a milk day where people celebrate the goodness of milk. But the truth of the matter is milk is not the only food, because I've seen mothers who are just giving only breast milk. See, 1 year, I mean, that child is going to have malnutrition. I know breast milk is good, and definitely you're not going to catch me say anything against breast milk. So you're allowed to give breast milk up to 2 years and beyond. But please, milk alone is not enough after 6 months. Okay, after 6 months, the children need to eat other food. They should eat variety. They should eat. I think a mother was asking this particular question that since the child is taking lots of milk and the child doesn't want to take the semi-solid, why does she need to bother? Couldn't she just be giving milk? No, the milk is not enough. Then after a while, you want to wean the child to others, and then how much volume of milk would the child have to drink to meet up with the calories demand as they get bigger? So as they get bigger, their tummy is still small. The amount of milk they will need to drink to supply all the calories they need is going to be in gallons that their tummy cannot handle. They will just become bloated. So that is why as they get older, the milk they're taking is fine, but you need to add other semi-solid or other solid food that can give them as much calories with not as much volume. So that is the idea behind it. So milk alone is not enough. Children need to take other food. All right, another one that children should not be given meat or fish. So this is a popular one when I was growing up. Okay, so parents believe that if you give children meat or fish, they are going to steal. So in the house, the father will eat 4 big chunks of meat, the mother will eat maybe 2 or 3, and then what the children will have to share one between maybe 5 of them. Actually, children need the meat more than you, the adults. And so most children will have become malnourished because their parents will give them the bar or the rice or the carbohydrate food and not give them the protein, because they feel that if children take protein they are going to steal. It is not true. Okay, so eating fish, egg or meat does not make children to steal. Okay, parents, the children should be given the meat, the higher quantity. The children are the one growing. Most of us adults, we are grown. You're already big enough, so you don't need to take as much protein. Even though you took, you like to take them, you often are the one taking the larger quantity. The ratio should be the other way around. It should be the children eating more meat, eating more of the fish than the parents, and it doesn't make them to steal. They need it because they are still growing, so they need a lot of protein. They need a lot of the fish. So let's give our, if there is only one meat left in the house, the children should have it, not the father. Okay, and not the mother. Yes, I said that with my full chest. Okay, if there's only one meat or one piece of fish left, let the children have it. Okay, daddy and mommy, the children are the one growing. You're already grown. Okay, and if you don't give them protein, they can develop what we call protein energy malnutrition, and then you're going to spend a lot of money. And we hope the children will not die, because it's 50% of all deaths in children. Protein energy malnutrition is a contributory factor. So we want our children to eat not just the pap and the eba and the rice. They need to eat the protein, and they need to eat it in good enough quantity, not the tiny pieces that we're always giving them. They need to eat a lot of it. And of course, the veggies and all that. We've talked about complementary feeding before, but I just want to correct that. Our children need the meat and the fish. Please give it to them. They need it for their growth. It does not make them to steal. All right, let's move on. Another myth is like boys should not take soya bean, that it makes them infertile. I've seen this a lot, and people believe that soya bean, there are a lot of theories and all that, but the answer is not true. Okay, it's okay for boys to eat the soya meal, bean or soya products as much as the girls. It does not make them infertile. And I keep asking, when people spin all these myths, I keep asking them to produce the person who has become infertile because they had soya. In fact, there are cultures where they eat a lot of soya beans and soya products, and the men are as virile and fertile like any other category of people who don't eat all this. So this is absolutely not true. It is okay for the male child or the children, the boys, it's okay for them to eat soya and soya products. Another myth is that when you notice, now we're moving away from diseases to some miscellaneous category now, that when you notice that your 6 or 8 year old is developing breast, then you need to press it down with pistol. This is a very, I've seen this, and I think a mother posted a picture, of them putting like stone or like pestle, like a wooden stick, to press down the breast of a child because they felt, oh, a 8 year old should not have breasts. Seriously, that is a very dangerous myth. Okay, there's absolutely nothing wrong from puberty. Age of puberty keeps going down every year, so 8 years old now is okay for a girl. And some of the girls are what we call early puberty. In other words, there's nothing wrong with them, they are just a little bit earlier than normal, and it's absolutely fine. So please don't press the breast of the child down, don't bind stone on their chest. Oh my God, it's not even, I just thinking of it alone is giving me headache. This is because it's a painful procedure for the child for something that is absolutely physiological, something that is absolutely normal. So please, let's stop. I know there are some cultures that believe in that, or rubbing charcoal or anything. Please just stop. If your baby is not having breasts early, it's fine. If you are worried, you can see a pediatrician so that we can tell you whether it is a normal development or whether there's something wrong somewhere and we can fix it. But it is not to press it down or to do any harm. Leave it alone, okay? And you just need to make sure you're talking to your child about hygiene, about sexuality education and all that. But please leave their breasts alone to develop. All right. Now the next one is, this is a popular one again, that when you want to transfer your baby to your back, you must touch the ground with the baby's feet first. I think this is a Yoruba culture thing, that you must use the baby's leg to touch the floor before you put the baby on your back. Actually, this is not true. I don't see any medical basis for it anyway. But it's okay for you to transfer your baby from your back without touching their feet to the floor. There's actually no medical uh, basis for that belief. Another popular myth is that you should not allow babies to look at themselves in the mirror. I don't know whether they believe that maybe baby will have nightmares or whatever. Again, this is a myth. I mean, there's nothing wrong. And babies actually like looking at themselves in the mirror and smiling at their image in the mirror and laughing. That is actually, for me as a developmental pediatrician, that is a normal developmental milestone that I want to see. So, but if a baby doesn't want to look at themselves in the mirror, they don't want to interact with their own image in the mirror, I'm actually more worried about that. So please, it is absolutely fine. It does not give them nightmares. Let children like to play, recognize their own image. It is part of recognizing the fact that, okay, this is how I look like, and all that. It is completely normal and it does not give children nightmares. Okay, we're running close to the end now. Some people believe that you need some myths about workers, that babies need workers to work fast. So I remember growing up, workers is like a standard part of things you must have for your babies. But the honest truth is that we pediatricians, we don't like the workers. So we don't want it. And the physiotherapists have actually said that it doesn't make your babies work faster. It actually make them work slower. Okay, so no workers, throw away the workers. In some countries like Canada, baby workers has been banned. Why we pediatricians don't like it? Because it can cause harm. I've seen children fall because of workers. I know mothers say, "Oh, it's not possible, it's not true," but we are the pediatricians that say all these things, okay? So when pediatricians are telling you that we don't want workers, you don't see all the children that we see with the injuries, with the accidents, because they are using baby workers. You are only looking at your own child in your own house where you're monitoring, but the mothers that have suffered, their child have suffered injuries because they're using workers, they won't come and tell you that. So please, it is not necessary, okay? Let your baby learn to touch the floor, crawl on the floor, walk on the floor. They don't need workers to work. They don't need it for anything. It's a dangerous piece of equipment, and many people are recommending for it to be banned completely. And I think it has been banned in Canada. If you check, you can check it out. Check American Academy of Pediatrics website. Check all those reputable websites about workers so that you can have this information. Okay, another myth is that a mom should never allow the baby to fall down from her back. This is a very popular myth, especially in the Yoruba culture, the Southwest Nigerian. That if a baby falls from your back, I don't know whether it's 3 times or something, that something will happen. They say those things to put the fear of God in you. So that's know that they will never allow that to happen. Actually, there's no medical basis, but we I think I like the myth partially in the sense that not because bad luck is going to happen to you, but because when babies fall from the back, if they hit their head, they're going to suffer head injury. So I'm more worried about the baby, not the mother suffering bad luck or anything. I'm more worried about the baby falling from a mother's back and sustaining head injury. So that is what we don't want to happen. So otherwise, it's just a myth. That's no medical basis whatsoever. It does not cause any bad luck. That's just what I'm saying. Okay, I think I'm getting to the end. I'm going to stop at number 70. So number 69 say a pregnant, if you're so that a pregnant woman has to sit in a particular way, you have to sit properly so that your baby's vagina or the vulva will not be wide. Again, these are just beliefs that has absolutely no medical basis. It's not true, actually. I don't know what to even say to that one, but it's not true. And the final one is about what pregnant women can eat or cannot eat. And people say a pregnant woman should not eat snail, because if she eats snail, her babies will be drawing saliva. I mean, that is absolutely not true. Okay, there are many reasons why children can draw saliva. Actually, some babies drawing saliva can be normal to certain age, until the age when you now expect them to be able to swallow it very well and not to drool. And then children who have some neurological issues and all that, they can, wet, drool a lot and wet their clothes a lot. So those are the children we worry about, and we have medications to deal with it, but it has absolutely nothing. And I've seen this in children whose parents don't even know what snails look like. Okay, so the parents don't know what snails look like, they don't eat snails, and the children also drew saliva. So this has absolutely nothing to do with eating snail or not. So yeah, pregnant woman, if you want to eat snail, go ahead. All right. Some believe that they should not eat plantain. That if you eat plantain, people have oka. Oka again is another topic on its own, which I think I've written a lot about. But it's not true. Okay. Your baby, you're eating plantain, that's not going to affect the baby. So I try to tell pregnant women there's nothing you cannot eat as long as you're comfortable with it. But we don't want to eat too much of liver, because of the too much of vitamin A can affect the baby's brain. We don't want you to take alcohol for obvious reasons, because if you take alcohol, you're also giving the baby alcohol, and alcohol it can damage the brain. It can damage the brain, and the baby will have what we call fetal alcohol spectrum disorder or fetal alcohol syndrome. So such children will have learning difficulties, intellectual disability, autism. They have a lot of behavioral issues. So you don't want to cause harm to your baby. And there's no safe level of alcohol in pregnancy. So better to stay away completely from alcohol if you're pregnant. And of course, we don't want you to smoke for obvious reasons as well. Smoking has a lot of danger to you and to your baby as well. And also, we don't want to take any of these recreational drugs, like heroin, cannabis, and all that. Of course, those drugs can have withdrawal effects even on your baby as well, the same way they affect you. So we don't want that. But otherwise, any food that you are comfortable you want to eat as a pregnant mom, you're welcome to eat that. Okay, I think I will stop about myths and facts in children of that number. I know there are many of them and we cannot exhaust them. If you want to know more, you can also check on our website. We've written about myths, the good, the bad, the ugly. So we talk about the good ones, the bad ones, and the dangerous ones. So you can learn more. And if you have any myths that you want to clarify, you're free to send it to me either by email, or you can post it directly on our Facebook group. So I really want to encourage us not to just take all these belief systems, and especially the dangerous ones that we've highlighted. If you are just joining the podcast for the first time today, please feel free to go and watch either the old videos or listen to the old podcast on myths and facts. And I've addressed them, about 70 of them. I'm sure you will learn a lot. And maybe if I have another set of compilation again, different from the ones I've given us today, we can take another section in future, but I believe we've covered quite a lot of them, especially the dangerous ones. The most important thing is for us to stay away from this myth and make sure that whatever information that affects our children, um, we are having the right information, the evidence-based information from the healthcare professionals. So thank you so much, everyone, for listening. Once again, this program is brought to you by Ask the Pediatricians Foundation. If you have any questions about any of the things we've talked about today, feel free to send it to me at drbimisola at askthepediatricians.com, or you are free to post your questions on our Facebook groups from Mondays to Saturday, and we are very, very happy to answer them. Once again, I want to remind you of our Ask the Pediatrician national community medical outreaches coming up in May and June. We look forward to you being part of that. If you want to support us financially or if you want to donate, the details are on your screen. So thank you so much, everyone, for watching today, and I will see you again next week with a fresh episode of Ask the Pediatrician Hour. If you have any particular topic you'd like us to talk about, also feel free to send it to me as well via email, and we'll try and talk about them. Thank you so much for watching, and have a wonderful day. Bye.